everyone. My name is Vinay, and we have Om from Samanvay Foundation. A brief overview of Samanvay Foundation. We are a tech non-profit. We've been building open source products in the for the non-profit space since 2017. These are some products that we've built. The first one is Avni. It's an open source SaaS data collection or case management platform. In some cases, people have taken it. It's also called Sakhi 2.0, Teach AP, Avni Gramin, Bamni Outreach app. These are all different forms in which Avni has been used. It also is available as Avni itself as a SaaS offering. There's also some other pieces that may be worth highlighting. One is about city budgets, which is like a budget planning system for municipalities in Maharashtra, and Gunak, which is a quality assessment tool for government health centers. We work mostly in software that is related to India. And let me give you a brief about Avni because that's where we are focusing this AI cohort with. It's a data collection and case management software for field workers. So essentially, you can configure if you are an organization that runs a field data collection field program. You can configure your field program using a point and click style interface. It will help you roll out a decently complex program on the field pretty easily. Okay, it works offline. It is multilingual, and it is essentially a SaaS kind of platform, which can be where the field users will essentially download an Android app and use it. So that's the background about the tool itself. What we want to do is we want to increase the access of Avni to people without having to have our support in building it and implementing it. So what we want to do is we want to build a co-pilot for Avni for users to be able to create applications with limited support from our team, so that the initial adoption of Avni is faster, easier, and cost effective. There will be cases where it can get complex, where we can handhold, but there is a level to which we can actually move things forward, and that is the hope from the co-pilot. We hope that more organizations sign up to the platform because of this. So that's in a nutshell what we wanted to achieve in the AI cohort today. While we were making this presentation, our mentor specifically asked, why not, because it's the age of AI, right? Why not have people build their own applications? What is the point of trying to put AI into an existing application? We tried looking forward to it. I actually asked ChatGPT as well why this is the case. Do we really need to do something like that? So what I understand is that the font is really, really small, but essentially that this is something that's been battle tested, which means that because we've been building over the years, there are features that make sense, and there is like a feature set that we know has actually worked because we've been building and also removing features from it, right? So there is like a set of what is necessary for a particular kind of app to go in, which already exists in the system, which is like years of whatever experimentation which has happened. We know how a feature needs to be built because we make mistakes and learn from it, and eventually the solution that works is what is put out. So that is one thing. And over the years, applications start getting robust. So it makes sense to build something on top of something that's existing as opposed to building something that's new. The other is things like offline. So offline is not really there with AI generated apps yet. So those are some of the things that will be hard to build if you're using something today. And then there is already a community and ecosystem. You can share things. So that was, while talking about sharing, I also thought about like things that we are building at SNEHA or IPE Global, because there are at least 10 different orgs that do exactly what you do within Avni. So we have a community through which we can actually share things, and that increases the value of something that one person builds to the entire community. So that's what I hope I answered your specific question. The solution design. So what we wanted to do was use something called Diffy. So if you see, this is our app creation interface. On the right hand side, you have a chat bot. We didn't build it. We used something, an open source tool called Diffie, where we could actually use it. I mean, the tool is in there, the content still needs to be trained and made available so that it's useful. So it also helps with orchestration, logging of things, building that chat UI. A lot of things are made easy because of that. We wanted it to be integrated with the Avni app designer. In the backend, we're using OpenAI API for the LLM models, some RAG content, and we built a little MCP server. We're not using it yet, but hopefully that will let us use whatever, like take that human language and actually convert it into an app. That is the hope within the Avni Copilot. Overall vision is that this is like one of the times where we can actually learn building within our internal tools that we are building. We've been using tools to develop code, for marketing, for generation of content and stuff like that within the company. But we also want to, because we are also open source tool builders, we wanted to use this to learn how to use, where to use, and how to build more things in the future. So eventually something like an AI powered product that can support cancer patients in navigating their workflow. These are all things that we have ideas in our mind, but we really want to get there from a capability perspective to be able to build something like this in conjunction with other nonprofits. And okay. Over the next 2 days, there were some features that we wanted to work with our mentors, which is what I put there, but not sure if it's relevant here. But we'd actually like to talk to everybody else also here to understand if there are, because what we're building can be used by others, but what others are building could be relevant to people, us as well. That's it. Thank you.
Just to give you a brief background about IPE Global, we are international development consulting firm. We are in this space from last 30 years. We are a sector agnostic firm, and when I say sector agnostic, we work across multiple verticals, whether it is health, finance, blended finance, livelihood, agriculture. And we do ground level implementation as well as evaluation. And then there is another vertical which do a lot of work on the tech startups, which are primarily for the healthcare. Next slide, please. Just to give you a brief background before Bank takes forward, we at IPE Global, we were implementing a program called as Rajpusht, which was there in the field for almost 5 years. It is a cash plus program which primarily is making the Pradhan Mantri Matritva Vandana Yojana more efficient, as well as doing a lot of SBC strategy in terms of bringing better maternal care and nutrition care to accelerate the low birth weight outcome. And as part of that process, we have a lot of data. We have data of a tune of more than 3 lakhs, and that's how we thought that in this particular phase of scale up, we want a AI model which can help to predict the vulnerable population so that we can optimize our resources as well as our efforts when we go for the scale up. I will hand over to Mayank and Jalpa.
Thanks, Akash. So, as you all know understand the situation, what we have seen, or as per the report of UNICEF, there are like 20 million children every year which born low birth weight, and alone India actually contributes 20% of the burden. So, to solve this problem, what is the basic issue? So, we really need to ensure the nutrition of the woman during the pregnancy cycle, and also taking care of the antenatal care. So we really need to identify, if we want to solve this problem, that what are the households which are at high risk. And to keep that, we have actually from this AI Cohort Program, we really wanted to leverage the power of artificial intelligence and machine learning to predict that which households are at high risk. As a long term, we also wanted to see that from the retrospective and the prospective data, how we can identify and prioritize the high risk household at the state and national level. As a short term goal, because we know that there is a time constraints also with us, that we will only focusing using our primary data set. As Akash told, that we have a huge data set from one of our program which we have run in Rajasthan. So we will try to identify the risk at household and try to see the adverse pregnancy outcomes and implement target strategies around there. But the long term would remain be the same, that we really need to accelerate the reduction of low birth weight. As a solution design, if we're moving forward, the main issue is that we really need to produce data which can fit in the machine learning. So from there, we will be starting from data collection, identifying the prediction targets, do the feature selection based on that. After the feature selection, we will develop a model, do a field test, and then ultimately do a model evaluation at the end. For field test, we have actually identify or do a field test we'll do in Bangalore in 2 districts as of now, with 3 to 500 around of samples so far. Tools, we will be using Python, NumPy, logistic regression, skit-learn, along with the validation of recall and the F1 score. As we know that for every process, there are certain constraints. So in this process also, we do have certain constraints, like there are publicly data available, but at aggregate level. If we talk about the National Family Health Survey or the Health Management Information System managed by the ministries, which during while we are using the aggregate data, it might be difficult for us to predict the individual household, because most of the data are available at district level or at the block level. Secondly, the availability of granular data to train and test the model, that would again be an issue. Timely completion, field testing, and the second iteration, because in this cohort we are sure that at least we will do a first level of iteration in our model, but we are not sure whether the second level of iteration would become possible or not. And then we are more that model would be generalizable for the larger population, not just the areas where we will be working on, because our larger vision is to support the government so that this model would be generalizable in across national level. Coming up to the opportunity, while implementing this model, definitely it will enable us to provide the policy level recommendations, also help government to support the targeted resources in the areas which are more vulnerable in nature, and also the national level integration of tool for better resource allocation and acceleration of reduction in the low birth weight. Overall organization, AI vision, I don't know why, but let me just tell you, at IPE Global, we are much more focused on enabled and provide support to the health tech up startups. That would be the one. Another is that we would also use machine learning in our evaluations for desk review, doing scraping or a large scale data analysis. And ultimately, which we are committed for this particular program, that we will use evidence-based programmatic solution targeting AI ML for intervention and improve developmental indicators. For that, what we really need to do, we really need to bring up or develop the internal capacities within the organization, and also develop or establish an architecture framework which not just prioritize need, align the data pipelines and design effective AI solutions. And ultimately, it will enable us to precisely taking data-driven decisions along with the optimized resource to maximize the program impact at the state and at the national level. A part of this, we are also working with one of the organization, Grifflick, where we are also building the AI chatbot. I would like Jalpa to talk about it more.
Thank you, Mayank. Thank you, Akash. Like Mayank and Akash explained, the objective of our program is basically to conduct more evidence-based planning for our next phase of large-scale intervention. The first phase was more pilot, like Akash said, and we had enough resources. And the second phase is going to be at a much larger scale, almost at a national level. So this AI and the machine learning programming, we are mainly going to use to prioritize the households or the individuals that require most care for improving the pregnancy outcomes. Similarly, we will use the Tech4Dev supported Glyphic platforms chatbot to also have differentiated SBCC plan for those women who are at risk and those who may be at lower risk of having adverse pregnancy outcomes. We will also use the chatbot to have frequent communication, which actually is not possible through the human resources, of course, because of the known gaps in the healthcare system. And lastly, also use it as a nudge box or a trigger mechanism for periodic reminders that a woman would need during their 9 months of pregnancy and the post-pregnancy, the postpartum phase with the neonatal care. So we are hoping that this AI program plus the chatbot program will really help us fine-tuning our differentiated service delivery models for the next phase of our work. Thank you.
SNEHA works on maternal and child health along with prevention of violence against women and children. We also work on employment of sexual health of adolescents. Along with that, we also work on public system partnership, that is working with the police and government hospitals, etc. We also work on palliative care, that is end of life care. That's just a gist about SNEHA. We also have a small map on all the areas that SNEHA works around, majorly in and around the MMR, that is a Mumbai metropolitan region. Yeah. Nisha, she's my colleague. She works as the M&E coordinator. I work as the data engineer at SNEHA. So we'll go back and forth on the presentation. Yeah, over on to Nisha.
Hi. So despite the recent advances in maternal health care, most of the maternal deaths remain preventable and are disproportionately clustered among women of the socio-economically vulnerable groups. So currently the pregnancy risk identification relies on checklist-based assessments and also mostly on the frontline worker judgment. And so while this is effective for the major medical risks, this approach often misses the interactive and complex factors that interacts between the socio-economic and demographic variables, as well as the subtle clinical patterns that are easy to miss. So achieving continuity of care throughout pregnancy would require coordination across services and prompt referral and identification services. So in line with that, we are proposing to leverage AI and ML to build a predictive model that integrates individual level factors, social factors, economic factors, and also biomedical factors to assess whether and when a woman may transition into low, medium, or high risk categories during her pregnancy. So through this, we are hoping to enable timely and targeted interventions. So what this would mean at an individual level is early identification that would lead to more home visits, fast-track referrals, and tailored interventions. And at the program level, this would help us optimize resources by aligning referrals with service proximity and the capacity of services. And at the system level, we are hoping this would lead to strengthened continuity of care, which translates into better maternal health outcomes.
So moving ahead on how do we plan on building the solution. So as Nisha said, currently when we say a woman is at risk, so we only have it black and white, whether she is at risk or not at risk. So you want to change that structure into saying that whether a woman is normal, low risk, moderate risk, or high risk. So first is that defining the spectrum. Followed by that, we are going to use we already have a heap of data which we are going to train using a supervised learning model. And accordingly, we are going to predict the risk. So if a woman is not at risk in the beginning, we want to predict if and when she is going to fall into risk. That is going to help us better identify and also optimize our resources accordingly, so that we can actually direct our resources more efficiently and in the right direction. And how we are going to reach that solution, we are going to use at least we have planned to use a supervised learning model, use a machine learning model, also probably leverage AI and other LLMs for most summary based understanding, and also basics of Python here.
And looking at the opportunities here, we are planning to move beyond simple checklist into a comprehensive risk scoring, which would help us understand the factors that are leading to what we call high risk pregnancy. And secondly, we also want to bring in data-driven scoring and assessments, which would complement the subjective assessments of the frontline workers. And third, this would help us optimize resource utilization by helping health workers prioritize timely follow-ups and referrals where and when it is needed the most. And finally, there is also strong potential for scalability and replication, starting with SNEHA's intervention areas in the Mumbai metropolitan region and then expand further from there. At the same time, the few challenges that we have identified is one is misclassification, where we would incorrectly flag a high-risk pregnancy as a low-risk pregnancy, which would lead to late referrals and vice versa. When we flag a low-risk pregnancy as a high-risk pregnancy, which leads to resource wastage. And another risk factor we identified was over-dependency, where the risk of frontline workers who rely solely on AI and the predictive data and overlooking their own judgment. And there is also the complexity of capturing the socio-economic variables because it is nuanced and the social risks, which also leads to the next challenge, which is the risk weighting. How do we assign severity or priority to each of the risk factors? For example, how do we differentiate between the risk of anemia versus maternal education versus hypertension? Because they all carry different weight of risks. And finally, one of the other challenges would be distributing data between training, validation, and testing sets to avoid bias and ensure replicability.
And also, SNEHA and its leadership has a very good AI vision on that. So we are going to use this predictive model to better, obviously, put into our program data to make our program more efficient. Along with that, we are also piloting AI chatbots, WhatsApp chatbots, and definitely that the chatbot part is like 24/7. So data and access is very easy for the community members. Alongside that, we're also going to use the data-driven decision making and make it more data-driven intervention. Along with that, resource optimization. So our immediate step would be to take everyone's help, all the mentors and guides and all the resources that AI Cohort provides us, and also to make sure that we are more responsible while using this community data that we are using. Thank you so much.
We are from Avanti Fellows. I'm Pujita and I'm a product manager. We also have another product manager with us, Dhyanesh. And we have Deepansh, who's our senior engineer. I'll start with giving a quick introduction to what is Avanti Fellows' mission. So our mission is to enable students in the low-income background to escape poverty. So that basically means that they need to land high-paying jobs. 95% of high employability courses are in STEM. And as we all know, less than 10% of applicants to the national entrance exams actually qualify these exams. And the most successful candidates spend about or more than 2 lakhs for private quality test prep coaching. So students from the low income background are systematically shut out from this pathway. And our mission is to provide access to high quality and free test preparation for students in government schools. This year, we also are looking more into ensuring that the students that we are selecting, coaching, and those that we help qualify, there's an equal representation of girls in this population of students. We have two modes of programs. One is a high-touch program and one is a low-touch program. The low-touch program are basically the states that we've partnered with, and we conduct test series for all the students in the government schools in these states. That is the only interaction that we have with them. We provide them with a content library that they can access on their own time, and we conduct tests for them and give them reports. With the high-touch programs, we actually have our own teachers teaching students, either through online classes after school hours or in person in the Navodaya Vidyalaya schools, where our teachers are in school with them, and they either take classes after their CBSE classes, or in some schools where there's higher engagement, they take the CBSE classes along with the coaching classes. Now we've noticed that, and quite apparently, that the high-touch programs are the ones that give us the most results. So we're now looking into how do we bring elements of the high-touch program into the low-touch program without worrying too much about the bandwidth, because we are low on resources. while that is one part of what we want to build with AI Cohort, the other thing that we're also looking into is, because we're dealing with students in social and economic backward classes, getting them into these, getting them to qualify these exams is a very personalized process, because as we all know, there's category ranks. It's very specific to a student and not just one solution fits all. And until now, we've been giving them a report after every test. We're trying to look into how do we give them personalized actionables after every test. So we're looking into taking in a lot of factors like what is their category, what is the kind of, what is their target exam, what are other things that we know about priority chapters, important questions to attempt, knowing that there are negative marking as well, and the student is being very focused on how they crack these exams. So we're starting with building a multi-factor recommendation engine with AI Cohort. And the next step is to then go a level deeper and identify any patterns where we see repeated weaknesses or repeated errors being performed, which we're not able to detect just through these factors that we've already established. The impact is obviously qualifying, therefore getting better score, but the immediate impact that we're looking at is how do we build a preparation strategy for students, making sure that they use the best of their time before an exam as well as during an exam.
I'll talk about the solution design quickly. So in this phase where we want to build the recommendation engine, so we have detailed data of students of their previous test attempt. So it's like all the data is stored in separate databases. So we need to look at those schemas and extract the information that we need to build the recommendation for the next test. So we have their existing test scores, how many difficult questions they answered correctly, and things like that. Then we have student profiles like students' demographic data, and obviously we have their previous test responses. And then we have our own bucketing that we have done according to our curriculum team, that these are high priority chapters for these categories and things like that. So we need to combine all of that and then can you go next? Yeah. So you need to combine all of that and kind of like kind of build a pipeline which runs on the background. So whenever the next test happens, it's finished. We generate recommendations based on that test and the previous test and all the other information, and those recommendations will be then distributed to the students. They can either access a web app, but not all students have access to devices at all times. So for them, we'll provide printouts, PDF printouts, and we are hoping that also we have to figure out a way to measure that, okay, do these recommendations are actually helping them improve their test scores in the subsequent tests. Can you go next? Yeah, so the pilot will be done in JNV Bangalore schools. These are quite high-end kids, and they'll help out with that. Yeah, I think mostly this.
Yeah. So one of the main things that we're also trying to figure out with AI Cohort is how exactly can we actually leverage AI and what kind of impact can it have for our use cases. And we're not just focusing on students, we're also looking into internal processes. For example, we have a curriculum team that creates papers for each exam type for each program. They spend a lot of time creating solutions, creating variations of questions, creating practice questions, testing the quality of the paper. So we're looking into how do we leverage AI to streamline all of these processes, to free up their bandwidth so that they can then focus on how do we actually improve student outcomes better. They can get more into the research work around it. And of course, also the student learning outcomes. Like I said, we have the most number of students, almost 10x the students we have in high engagement programs and our low engagement programs. And what are some ways that we can actually leverage AI to bridge this gap? Career guidance, counseling, all the high touch points that a teacher has with a student, how do we bring that relationship, or how do we try simulating that relationship to a certain extent? So we've started talking to the different teams within Avanti Fellows to see what are their bottlenecks and to see what are ways that we can actually solve for it with or without AI, but specifically with the team to see how are ways that we can solve it using AI. Yeah, that is what we're doing.
Good morning, everyone, and so nice to see all of you here. I'm Vivek from Inqui-lab Foundation, and I have Ajay, our data engineer, and the man behind who is developing this solution, and we have super efficient mentor Akanksha here as well. So at Inqui-lab Foundation, what we essentially try to do is how do we build critical problem-solving capacity, innovation, and the 21st century skills in students through innovation programs. And we have both offline programs and as well as blended programs through which we are currently reaching over 1 million students every year with the same objective, right? How do we inculcate these skills? And children have a lot of ideas. How do we take that forward? And currently it is across all the states. And what we are trying to do is how do we integrate this into the formal education systems through the Atal Tinkering Labs, Atal Innovation Mission, and also the Ministry of Education. So yeah. So coming to the problem that we are trying to solve here is, say there are a lot of students who are participating in these innovation programs across through different programs, and we are receiving a large data set of their idea submissions and different artifacts in the form of worksheets, their drawings, or say even the text that is there. But what we have realized that the issue that the current system is facing is there is no, there's a two-level problem. One is at a business side, which there is no effective evaluation mechanism, and it is a lot more resource intensive and cost intensive as well. And then there is a second level of challenge where there is no feedback that is going back to the student or the teacher to aid in their learning outcomes. So to address that challenge gap, what we are trying to do with the support of AI Cohort Program here is to see a two-level solution. One is how do we leverage AI as an evaluator and also AI as a mentor, where we address both the problems, right? Like while we keep the evaluators in the loop, how do we address the business challenge case and also the scale case of evaluating the student ideas, which give them internship, entrepreneurship, and certain grant that the government can unlock for the students. So what it can essentially unlock is there is a grant by Ministry of Innovation Cell, Ministry's Innovation Cell, around 13 crore grant is there for the students to leverage, and right now only 5% of it is being leveraged. And the other gap, which is very clear, is like how do we enable that these large set of students, almost close to 1 million students, get the feedback and get the guidance that they deserve. So currently there is a manual process, and what we have tried to do is like, maybe Ajay, do you want to take this quickly?
Yeah. So actually, because this process is happening since last 1 year, and there's an established rubric, which we can see here. There's a 5 parameters on which a student's been evaluated, and based on that, they have sent it to the next levels. And what we have done as a part of this program is that we are trying to see sort of how do we use the LLMs and the prompting to do the same thing, and sort of it's a very this seems to be very nuanced, and where the humans beings able to understand and abstract at many levels, and we are able to use the LLM's prompt technique, zero prompting technique, and able to break it down. And we have sort of tested this model on the 50 sample set, and we sort of got the more than 85% of the accuracy, and we sort of wanted to test on the larger data sets because we have the sample of about 1.5 lakh, and we would like to see, and that's like there as a part of our future roles.
Yeah. So as we engage in the development phase, how we are planning to roll out is, say once we develop the tool or do the internal validation, can we do a small scale pilot within the offline schools that we are interacting with? The program team will kind of validate and see how it is actually generating the evaluation or the feedback and try to assess the tool, and then do a small scale pilot at a district level, and then see how we can integrate into the national scale of school innovation marathon around December or maybe the next cycle. That's the objective that we are trying to do. And our focus will be first on the evaluation piece, where there is certain scoring rubric and kind of evaluate the ideas. And then in the next phase, kind of fine tuning the feedback and see what kind of feedback and how, say it is matching close to how a teacher would give a feedback or how an expert would give the feedback. So coming to the larger vision, what we are aiming to build while we start with the mentoring and evaluation piece is say how we can leverage AI in building an innovation ecosystem for schools and maybe provide that to strengthen the ecosystem using Atal Innovation Mission or the PMC schools or the state departments emerging focus on the innovation. That's a larger goal, and as an immediate step, we would focus on building the prototype, testing it and fine-tuning it, and also while we build our own internal capacity as a team, learning more about AI and how do we build this larger ambit of solutions to aid innovation culture in schools. Yeah, that's it. Thank you.
Be helpful if you remember when you were in school and you had to make that decision, should I study arts, science, or commerce? And then when you were in 11th and 12th to make the decision of what the next step of education was, right? In the worlds that we came from, some of us, it would probably be fair to say that we came from a space of privilege and there was access to information in the capacity of teachers, good schools, maybe friends, but there's an entire universe out there where this doesn't really exist. It's fairly underserved, right? And what happens as a result of that is people end up in spaces of work where they just feel like, why am I doing what am I doing? I know we also save that, but it's more pronounced there, right? And so that's what Quest Alliance really tries to do. It kind of tries to bridge that gap. And the heart of the experience that we try and create is that 4-step process, which is our learning experience framework, which says that it needs to start with the C part. I need to understand what I like, what I don't like, what my aspirations are, what my dislikes are. And after I have a sense of that, then I, go to the next step, which says that, okay, now that I have a sense of who I am, I understand what's out there in the world, I make a choice, then I start preparing towards it, then I actually take that job, let's call that the first internship. I work as a data science intern for the first year, realize it's not my cup of tea, and then I go through the whole process again, right? So that's what we do as an organization. So how do we do this is, I draw an analogy of, say, mango farming. Say there's a farmer in Ramnagar who produces 1,000 kgs of mangoes every year. And he has a problem where he's able to sell only 300 kgs of mangoes and 700 kgs of mangoes goes to waste, right? And the innovation that he thought of was that if I can't sell mangoes as is, maybe I can make jam out of it or preserve, for example. So that is innovation. Now, this farmer goes to all the other farmers and then he says, hey guys, I figured out this really cool way to solve this problem. And that's really him enabling the other farmers. And then he says, but we're only talking to farmers in Ramnagar, but mangoes are grown all over India. So, how do I spread this far and wide? And that's when he says, goes, for example, to the government, and then they spread it across the country, right? So as an organization, we're also kind of structured in that structure and that format. So with respect to what we're trying to build right now, the space that we operate in is largely in like industrial training institutes, vocational training institutes, which are like other organizations that are also trying to solve this problem of skilling. And also government high schools, right? And fundamentally over here, these students don't really have access to teachers in abundance. The student to teacher ratio is less. And also when they do have teachers, the amount of headspace that the teachers have to pay attention to those children is not enough, right? For a child to move to a point where they are aware of what they want to do in their lives, right? And so this ambitious dream of trying to augment that space by introducing, say, something that is powered by AI is where this idea came from. We're trying to be conscious to say that we don't want to create like an information dissemination system, which is a traditional RAG and what a traditional bot does. I think for us, what we're trying to ground ourselves in is to say that if you had to create a mentor, what should that persona be and what should that mentor really look like? And what do your learners really look like, right? So over the years, Quest has kind of looked at saying that learners can typically fall into 11 macro behaviors. They would demonstrate these kind of characteristics. If you're able to catch that characteristic, then you'll be able to say that, okay, my learner is strong here and low here. and therefore that's where I need to intervene. Um, and and then the way the algo is kind of designed, I don't think we've finalized this, but we're in our early stages where we're saying that we want to start with doing some amount of semantic classification, understanding what the learner is saying, and then saying if they're saying this, then put them there. If they're saying something else, then put them there. And then perhaps use LLMs to sort of throw out the response. And while we're doing all of this, making sure that we do it the right way, which is to be responsible. I think for us as an organization, much like the work that we're doing here, we've been saying that it'd be so useful if we could combine our powers and leverage the power of community. And that's in many ways just kind of been like I don't know, like a pie in the sky statement, but not so much something that we're actually doing. So this year we thought, okay, maybe we need to shift gears and actually do that. And it'd be cool if this cohort can also do some of that, because there's so much of intersectionality of the work that we do. And if there's something that that we don't know, or vice versa, maybe we can sit in the same table and discuss it, right? It can at least even start with a conversation, if not necessarily from a platform perspective. But what this is saying, I think, is fundamentally that all of us really say that our beneficiaries are here at the center. And if we are sitting around, the peripheries of scaffolding, then we need to be more coherent to not inundate these guys with like 5 organizations going and saying, this is how I believe skilling should happen, you use my app. And that's what happens, right, in a lot of these spaces. So how do we kind of not do that and make sure that we come together is what the larger platform vision is.
I'm Vaibhav. I'm the state program MD lead for state programs, and I'm with Shadab, who's my teammate for this project. And I'll talk a little about what we do at SEF. At SEF, our belief is that teachers are that sole support system that can act as a catalyst of growth in a student's life. So for the past 11 years, we were working in the space of teacher professional development, and we started our work with the partner school programs, where we build model schools, where we innovate and experiment and figure out what works best for teachers. And then we scaled it through our in-service teacher development program, where we partner with states to implement those findings at the state level through teacher development. And in this process, we also realized that just building teachers that are teachers now is not enough. We also need to build teachers for the future. So we started the Teachers for Tomorrow program, where we build with DLED and BLED program students that are going to be future teachers, and we equip them with skills and practices required to excel as a teacher. So in the in-service program that I talked about, we have been doing that for the past 4 years, and we realized that at the national policy framework level, there does not exist a mandate for like continuous teacher development. There exists one, but it's fragmented, it's inconsistent, and it's mostly compliance driven. And largely the support that teachers get are through these trainings, and maybe some coach visits. They have teacher coaches. These coaches visit them maybe once a quarter or maybe biannually. And this is not because there's no intention to support these teachers. It's just the lack of resource and bandwidth leads to these problems. So the solution that we're building, it intends to bridge this gap of teacher support. We're building an AI-powered teacher buddy that will provide a continuous support system for these teachers. And this teacher buddy, it's a WhatsApp bot that the teachers can access through WhatsApp easily. And what this does is that it will provide teachers with contextual and tailored classroom practices and activities based on their situation, based on their context, where they are, what they are doing. It will also bridge the gap of training to classroom adoption by providing instant access to state level content and resources given to them during these trainings. And what it will also do is it will take those fragmented evaluations, compliance driven evaluation that the state does to figure out what they need to do the trainings on, and it will build reflective habits on the teachers, and that data will help us create a feedback loop at the systems level for the state to use it to create more targeted and tailored interventions for those teachers. And the impact we are intending to create is hopefully significant. What we want to work like is the teachers won't have to wait for maybe months or even weeks requesting coach visits to get feedback on their coaching practices, or just figure out challenges that they're facing daily in a classroom at the academic level. It will again bridge that gap of training to classroom level adoption. Whatever the state wants to provide to the teachers, it will have, the teachers will have instant access through that WhatsApp bot, and it will create that real-time feedback loop that we talked about for the system to create more targeted teacher intervention programs. Next, Shadab will talk about the pilot plan and what we intend to do with it.
Thanks, Vaibhav. So for this, so we are trying to create this MVP, and for this MVP, what we want to do is create a classroom engagement support. And the other thing that we want to do is reflective practice. And in this, you can see that we have written data only because right now what we are trying to nail is the reflection journey of the teacher on the bot. But eventually, we want to use this data to create some sort of evaluation system so that the teachers also get to see their progress in their reflective journeys and their skills as well over time. So some sort of evaluation system down the line with the, and we would want to lay down the groundwork for it and during this cohort time with our mentors. So the pilot goals are what we want to validate this as a channel for continuous support. We have to test the teacher acceptance and is it easy to use for them and how we can improve it. We want to monitor AI risks and build a roadmap for productization and scale. At SEF, like we look at AI as something that should supplement and augment rather than replace. And what we want to do is unlock new possibilities for the teachers and education systems so that they can make smarter decisions, personalized learning, and scale what works. Likely impact is like we want the teachers to apply context-specific strategies in real time and use data-driven insights to inform targeted, scalable state-level training and policy. So the immediate next steps in this is designing and piloting the MVP and creating a productization roadmap with our mentors. Thanks.